Hello everyone and welcome to my presentation. My name is Phillip Harter. I am a senior student studying political science. I am working under the mentorship of Dr. Keith Stantz. And today I'm going to talk about Trex1 regulation of INF beta and the theoretical modulations by TNF alpha. Our lab looks at how immunotherapies can be used and using biological pathways to destroy tumor cells. So immunotherapies are those that use your own immune system and radiation to destroy cancer cells. What happens is that when DNA is broken by radiation, it accumulates. And the accumulation of DNA causes the secretion of INF beta or interferon beta. Now, this is a signal to other cytotoxic C cells around you that the cell is in trouble, or is defective, or is a virus, or in this case, a cancer cell. And when the T cells recognize interferon beta, they destroy the cancer cell. And so we use radiation to stimulate, using the STING pathway, interferon beta, which causes this response. Now, Trex1 is an interesting part of this pathway. Trex1 is a DNA exonuclease that degrades the accumulation of DNA. So when your DNA is all piled up, Trex1 notices that and clears it. It's as if you're a child and you have a lot of laundry scattered in your room and your mom comes in and cleans it up. That's kind of what Trex1 does. It cleans up the DNA mess that radiation makes. The problem is it also decreases INF beta stimulation. It has been shown that in thresholds at a threshold of 12 to 18 grays and anything really higher than that Trex1 levels become high enough to where they can degrade DNA that is accumulating in the cytosol of these irradiated cells, thus kind of making the immunotherapy a moot point. This is important because we have to be finding, we don't, right now the pathway that regulates Trex1 is not known. Studies indicate that high radiation doses have high levels of Trex1, but we are going to be looking at the relationship between Trex1 and interferon beta and trying to quantify that and evaluate this threshold and see what that relationship is, and document the relationship between Trex1 and interferon beta. So for our study, we used Merkel cell lines, which is something that our lab has traditionally used. It's used in a lot of studies involving such kind of inflammatory markers, and it is a rapidly replicatable cell line, so it's easy to us to culture. To quantify Trex1 and INF beta, we have used qPCR to quantify the amount of the mRNA present. Cells were radiated at doses between 0 to 24 grays, and interferon beta ELISA kits were performed to quantify the amount of interferon beta protein present in the cells rather than the mRNA. So we're looking here at the qPCR data, which shows us the amount of folds increase, which is the y-axis, of mRNA present compared to standards for the two after irradiation. And what you'll notice is that we have a trend of interferon beta where there's not enough radiation to quite stimulate an immune response yet. Then you get a jump at around 14 to 17 grays and then a decline, which is an interesting thing to compare to the Trex1. Trex1, you can most starkly see with beta-actin, is that it has a slightly linear progression at higher doses of radiation. This counters the expression of INF beta. As Trex1 seemingly goes up, we see a little bit of a decrease in INF beta. While our data is currently small, this is very much an encouraging sign for us to see that this kind of relationship exists between Trex1 and interferon beta. What we've also done is we've also seen that interferon beta has changes of expression on radiation doses in our ELISA. So in the ELISA kit, we have seen that for the most part, there's a similar trend. There's a big spike around 17 grays, around that threshold before Trex1 is turned on. So there seems to be a threshold of immune response that's very good for radiation doses. north of about 12 grays till you get to about 17 grays, where there's interferon beta, but Trex1 is not quite yet expressed. But then when Trex1 starts to become expressed at higher doses of radiation, there's a sharp decline of interferon beta, which is what we have hypothesized and seeing, and what we are seeing with our data right now, is this sharp decline of interferon beta expression. But the question becomes, why is this happening? Why is Trex1 turning on at higher doses of radiation? That's the question the literature still doesn't know. And over the past year, I've been working on literature review and preparing studies and looking at different ways as to this can happen. And one thing that I have come to conclusion on is that there is something called tumor necrosis factor alpha that has an autocrine pathway that potentially modulates Trex1. Now, the present day literature is kind of divided on TNF alpha in a clinical setting on what it can do with improving the efficiency of radiation therapies and immunotherapies. Some say that if you flood the cell with tumor necrosis factor, obviously you're going to cause the death pathway, which leads to tumor cells dying. But that can be tricky to cure cancer because when cells die, oftentimes they do something called autophagy, which is self-eating. And if immune cells do not get to this tumor cell first, this can cause the tumor cells to continue to proliferate because they haven't been killed by the cytotoxicity cells, so they've merely escaped destruction by our own immune system. Now, there are other studies that say, well, let's try inhibiting TNF alpha. But again, that could cause the death pathway to not be significant, or, as I'm suggesting, it could cause regulation, it could cause improved radiation therapy because there would be less TNF alpha or less Trex1 being produced downstream. Studies currently have shown that in high doses of radiation, 40 grays, TNF alpha displayed significant increase in expression of breast cancer tumors within 30 minutes. That's pretty significant, but it also is a pretty high dose of radiation. Won't typically be seen in a clinical setting because it's a very high dose of radiation. But what we've also seen is that in lower dose radiations, TNF alpha has had a 5 to 10-fold increase in presence within 48 hours. And somebody who's getting constant radiation therapies would have something that would most likely resemble this kind of trajectory. And this was seen in prostate cancers. So why is this clinically significant in the grand scheme of things? Well, it's because TNF alpha inhibitors already exist and are already used clinically. A lot of them are used for Crohn's disease, rheumatoid arthritis. They're already FDA approved and they already exist for use. A lot of them include GI tracts, but they currently aren't being applied to supplement immunotherapies and radiation therapies because the data is still mixed. So the question becomes, how is this working? How is TNF alpha increasing, or how is it increasing Trex1? How could it do it? Well, the pathway is quite interesting. You've got ionizing radiation, which you use to stimulate immune responses, and you use to increase DNA breaks, as we've already discussed. But another response to double-stranded DNA breaks that occurs is TNF alpha is secreted. But oftentimes, TNF alpha has an autocrine loop where it binds to TNFR1 receptors on the cell. And this will stimulate many pathways. TNF alpha has been shown to be involved in necrotic pathways, which cause death of tumor cells, apoptosis, which is further death of the cell. It also has been found in autophagy pathways. It's been found in prolonged life pathways, even inflammatory pathways. TNF alpha has a wide range of pathways that it impacts. But one specific one that it turns on is this MKK and JNK pathway. So the MKK, the MAP kinase pathway, activates something called the JNK pathway. And the JNK pathway has also a lot of things that it does. But one of its most interesting products is these two proteins in the nucleus called c-Jun and c-Fos. These are specifically interesting when it comes to Trex1 because c-Jun and c-Fos, when they come together, they form a complex called AP1. AP1 is a known transcriptional factor of Trex1. So if you increase the amount of transcriptional factor present, you should increase the amount of Trex1 present. And studies have shown that increases numbers of AP1 have increased the number of Trex1. So our hypothesis is that ionizing radiation will increase TNF alpha, which will increase AP1 downstream, resulting in the increase of Trex1 that we've seen at higher doses of radiation. And since we know tumor necrosis factor is modulated at higher doses of radiation, then our hypothesis is that Trex1 downstream is being regulated in the same fashion at the end of the pathway. Now, our lab is still trajecting towards getting these numbers and data for TNF alpha. At this time, we really have the illustrated relationship between interferon beta and Trex1 pretty established. So our lab is going to be moving into exploring this hypothetical pathway for modulation of Trex1, now that we can see that it really regulates INF beta to some extent. The reason we're kind of behind right now is the COVID pandemic has limited our capabilities as a lab. We were going to do a lot of research this past summer until the COVID pandemic hit, which kind of set us back a little bit, which is why we are currently still working towards these greater goals. But I still find that the findings that we have so far are worth presenting to the community, as I think they are significant. But our lab is going to be looking towards quantifying TNF alpha in the presence of tumor cells following radiation. We're going to be doing this with qPCR and ELISA, just as we did with interferon beta. We're also going to repeat the studies after inhibiting TNF alpha with laboratory agents. We have a couple of laboratory agents identified that we can use to inhibit TNF alpha, and this will allow us to have a better regulation of TNF alpha and explore to what extent it's modulating the levels of Trex1. Two of our loftier goals downstream are to quantify the downstream products of TNF alpha and JNK pathways to further ensure that this pathway is what's modulating the Trex1 levels. So that would be looking at levels of AP1, C-Jun, C-Phos, those things in the nucleus that eventually produce more Trex1. And finally, our lab's greatest purpose is to study how hypoxic environments influence these kind of pathways. So now that we've established this pathway and we've looked into it and how it modulates Trex1, we're learning how hypoxic environments can impact this expression. Hypoxic environments of tumors are known to be the hardest to treat with radiation and immunotherapies. They are the peskiest ones, and the reason why that is so is not thoroughly understood currently, but it has been documented by research over and over and over again. So our lab is looking into why that might be, and this pathway might be one of the reasons as to why hypoxic environments are more dangerous, and this could offer a way for us to get around those hypoxic environments and treat more of the more dangerous tumor cancer environments that exist currently. Now, before I conclude this presentation, I wanted to make it clear why this research is important. Cancer therapies like chemotherapy and radiation therapies, they take a lot out on patients. They result in a lot of long-term side effects. I myself am one who have had cancer and had radiation therapy. And although mine is a more advanced form of radiation therapy, proton radiation, I'm still dealing with residual side effects. So this research has a very personal tie to me. Immunotherapies have the ability to reduce side effects of patients because we employ our own immune system to take care of the cells rather than just destroying them entirely, destroying the tumor cells, that is. And so I think it's very important for us to continue to do this work. And although the research we have currently is very scanty on the data, we have a lot of backing going forward. The data is very positive for what we believe we could do moving forward. And so our lab has good trajectory towards what we are going to ultimately work towards, which is continuing to look at TNF alpha as its ability to modulate these pathways and Trex1 levels. And we also want to look at hypoxic environments so that we can help those who are at the most disadvantaged right now when it comes to radiation and immunotherapies, dealing with those higher level hypoxic environments. So with that, I would like to thank you all. I wish I could take questions, but unfortunately with this environment and this way that the things are right now, I can't take questions, but I would welcome any questions that you have for me. If you want to reach out or anything, I would be appreciative of any questions you might have or any comments you might have. And as I have up here my references, these are only the ones significant to the presentation today, but I can tell you that I've done a lot more literature review on this. So I'd like to thank you all for coming, and I hope that you all have a very great day. Thank you.